Rahman Rahim. We are going to talk about professionalism, called in Arabic Mehniya wa Ihtirafiyya. It's very important that people in the profession understand professionalism. The concept is difficult to define, but basically it has to do with the attitudes and behaviors of the professionals, and it has been developing from very simple beginnings to become a very important aspect of medical practice. And today we have got many professional organizations whose main responsibility is to make sure that professional standards are maintained. We need to go deeper and ask ourselves what constitutes professionalism. I will present the American view of this, and then I will present the Islamic view of this. The American Board of Internal Medicine described 6 dimensions of professionalism. There is altruism, accountability, excellence, a sense of duty, honor and integrity, and respect for others. It also described what is considered negative dimensions of professionalism, like abuse of power, sexual harassment, conflicts of interest, professional arrogance, a physician who is impaired and he continues practicing, and fraud in research. But when I look at these dimensions, whether positive or negative, I realize that maybe they may not fit properly into our own intellectual and cultural and religious heritage. That is why I propose 7 dimensions of professionalism from the Islamic perspective. We start with faith is Iman. Without Iman, many things will go wrong. Then there is consciousness of Allah subhanahu wa ta'ala, taqwa, to know that whatever you do, Allah is watching you. Then best character, when we behave and deal with others. And excellent performance, itqan al-amal, that whatever we do it in the best way. We need to strive towards ihsan, which is perfection, and we need to carry responsibility, amana, and also be able to check ourselves, muhasabat al-nafs. Now, professionalism is best taught by apprenticeship, by watching people with good professionalism, and then we learn from them. Now, we will now look at some case scenarios that illustrate professional problems. I'll give you a minute to read it, and then we will discuss it. This case scenario number 2. No. Case scenario number 3. Let us now talk about the physician's professional relationships and duties. The physician has got several roles. He is a healer, he is an advocate, and he solves problems in the hospital and also in the community. He has got duties towards the profession. For example, he has got to do research to advance knowledge. And he has got a duty towards colleagues. He must help other practitioners, especially helping them avoid making mistakes and committing unethical things. Now, we have a case scenario about a professional violation. Case scenario number 2. Case scenario number 3. Now, let us talk about how to deal with the pharmaceutical industry. The pharmaceutical industry is very powerful, it's got a lot of money, and it's a business. Now, dealing with the pharmaceutical industry, we sometimes experience conflicts of interest. Now, a conflict of interest is maybe financial, when the doctor, for financial gain, may make a decision that is not in the best professional practice. Or it may be non-financial, but whatever interest affects our judgment as doctors creates a situation of conflict. Now, pharmaceutical industry sometimes send people around the hospital. They give some gifts, they give free samples of drugs. Do these affect doctors' prescription habits? Are doctors influenced to add medicines to the hospital formulary because of these gifts that are given? Do doctors get affected in reporting research results because of what gifts the pharmaceutical industry does? So, what do they give? They give free drug samples. Sometimes they pay expenses to attend scientific conference, which is good. Sometimes they employ doctors as consultants. They give them money for giving lectures, give them money for doing research. The important thing is that we have to be careful that whatever we get in terms of material or non-material benefits do not affect our professional judgment. Because if our professional judgment is affected, we are being immoral, we are being unethical. Now we have got a case scenario about this conflict of interest. Again, conflict of interest. Yeah. Now let us talk about medical errors. A medical error is anything that does not follow the accepted standards. Now, malpractice is a subset of medical errors. Malpractice is when we do not follow the standards. It's a type of medical error. Another subset is negligence. Negligence is malpractice that results in harm for the patient. Now, there are several types of negligence. There's contributory negligence, when a doctor contributes to causing the harm. He doesn't cause all the harm himself, others are involved. It could also be comparative. Intentional negligence is very rare, but it could occur. Now, in order to prove that there is negligence, there are elements that the law will consider. First of all, we'll ask a question. Is there a duty? Was this doctor the doctor of the patient? And if he was the doctor of the patient, did he breach the duty? Did he fail to fulfill his duty? And then, did the injury result from this breach of duty? So these are three elements that are considered in proving that there is negligence. Of course, the burden of proof is to show that there is a causal relationship, a causal connection between the breach of duty and the injury that the patient experienced. Now, there are certain liabilities. When doctors make mistakes, they could be held liable for battery. For example, examining a patient without informed consent is considered battery. They could be held liable for errors. They could be held liable for neglect of duties. Now, vicarious liability arises when a senior doctor fails to supervise a junior one properly, and the junior one makes a mistake. When the junior makes a mistake, the senior one is involved, he's liable. When there is a mistake in the hospital itself is liable. And if the equipment used was the cause of the injury, the manufacturer is also liable. Now, there are several legal bases for liability, like breach of contract, negligence, and breach of confidence. That can be discussed from a legal perspective. And when there is injury, doctors may have to pay damages for personal injury, for death. Sometimes, like wrongful birth. If, for example, the doctor prescribed a contraceptive that doesn't work, you could be charged for wrongful birth or wrongful life. Now, if a doctor commits any mistake, any error, it is an ethical requirement that they have to inform the patient of that error. The disclosure must be immediate and must be complete. We cannot hide errors. Now, there are several examples of negligence that can be given. Treatment without informed consent, talking bad about patients, failure to warn patients about risks, and failure to report a notifiable communicable disease. These are just examples of cases of negligence that could arise. Now, in obstetrics, for example, injuries to the mother and the fetus could be considered negligence, and there are many other examples that we do not need to go through. Now, in psychiatry also, there could be negligence like failure to prevent suicide. If a psychiatrist fails to diagnose suicidal tendencies and the patient goes on to commit suicide, he could be liable. If a patient commits violence that could have been prevented by timely diagnosis, that could be a cause of liability. Now, when it comes to proving negligence, there are certain exceptions. It does not mean that whenever there is breach of the rules resulting in injury, that the doctor is always found negligent. The Bolam case was a court case that was discussed and tried in court, and it became a principle that a doctor in one place may practice differently from the local accepted guidelines. And if there is injury, the doctor will not be held liable if you can prove that what he did was according to another practice that is widely accepted in another country. So this is the Bolam case. There is also a Bolitho case that was tried again in the courts, and it says that a doctor cannot be found negligent if the circumstances in which he was working could not allow him to practice according to the standards. For example, if you go to see a patient in a home situation where there is no oxygen, there's no intubation, and if that patient suffers brain damage, the doctor will not be found liable because in the circumstances there is nothing he could have done. He did not have the necessary equipment. Thank you very much for listening. Wassalamu alaikum.